Pregnant or planning? Get holistic support with 9 and Beyond, your trusted pregnancy companion. What is egg freezing and what is the process which you can explain step by step?
Yes. Yeah. So egg freezing is a process wherein we harvest your eggs and freeze them today so that you can use them later anytime in life whenever you are ready to have a child. So in a way, we are actually giving a pause to your biological clock because the eggs which I freeze today, they're going to remain in the same quality. The aging related changes will not be happening in those eggs. So even if at a later age you plan to use these eggs for your pregnancy, these eggs will still be healthy. So that is the advantage that we are giving a pause to the age-related decline in the quantity and quality of eggs.
Especially the quality, I was.
Exactly.
Right.
Yeah. So the process is pretty simple. It involves a few steps. The first step is that you need to meet your infertility specialist who will probably examine you, take your history. They might do an ultrasound to check for your ovarian reserve, as I just said, and they might ask you to do certain blood tests to look for your overall health and also to check for your fertility reserve, confirm it again. The actual procedure starts once you get your periods. So normally we start on day 2 or day 3 of the cycle. The treatment includes administering certain hormonal injections, which you need to take for 10 to 11 days. These injections are not painful and you can carry on with your routine activities, home activities, professional activities, everything during this
They
time.
have no side effects.
No, you have no side effect and you can carry on with all your activities like you were doing earlier also.
Okay.
But during this time, we might call you to clinic a couple of times because we need to do scans to keep a track on how your eggs are growing. Normally, on an average, a girl needs around 10, 11 days of injection before we see that the eggs are ready. Now, once the eggs are ready, we schedule the egg retrieval procedure. It's a small procedure which is usually done under IV sedation or general anesthesia. There is no cut on your body. We put in a needle through the vagina and we retrieve all the grown eggs.
Okay.
Once we take out the eggs, we scan them for maturity and quality, and all the good quality mature eggs are then frozen by a specialized freezing technique called as vitrification. And then these eggs are stored in liquid nitrogen cryo containers for as long as we want. So that's how the procedure usually works.
Lovely. So again, would you recommend the women out there to, if they're planning to freeze their eggs, a particular age where which is idealistic that they, since they have to do it, they might as well do it in that age, or would it
See,
be like
the ideal age would be when I can get maximum number of good quality eggs.
right?
So looking at the fertility potential, that will be in the late 20s or early 30s
Okay.
because the quantity is also good and even the quality is very good. But saying that, we need to consider that it is not that older women cannot freeze the eggs, just that we might need more number of eggs and the freezing procedure may not be as efficient as it would be for a younger girl. But then we do a lot of freezing for women in their late 30s also. And in fact, we have done some procedures for women in the early 40s also because they still want to explore that possibility of having their own biological child. So yes, you can do it, but then the efficiency will not be as good as it would be in a young girl.
So, you would say that, okay, that is the idealistic age. Then would you also say, I mean, what is the quantity like? Do you need more cycles, the menstrual cycles, or is it one cycle enough to get the quantity?
See, this again depends on what age we are freezing. See, we should understand the intent behind doing egg freezing. The whole idea is that when I'm using these eggs at the later stage, I should be able to give you a baby at the end of it, right?
Okay.
So when you are young, the quality of eggs is also good. So we need less number of eggs to fulfill the same job. But as you grow old, the quality of eggs is less. So I need more number of eggs. So the usual recommendation is if you are freezing less than 35 years of age, around 10 to 20 eggs is a good number. But if we are freezing for more than them, like 35 to 38, we would recommend somewhere around 15 to 25 eggs. And for women more than 38, though the reserve is pretty less, but the ideal number would be somewhere around 20 to 30. So whether they need one cycle or not also depends on the wear and reserve.
Then,
Young women have good reserve. So it is very possible that one cycle we may get like 12, 15 eggs and that's enough. But as you grow old, your reserve falls, the quality of egg falls. So then definitely you might require more number of cycles to have the recommended number of eggs.